So coming to the last question of NEET PG 2024 recall. So this is a big question. We'll read the last line. What would be the ideal next step evaluation? So some disease has to be diagnosed and we have to tell what is the next step. A 50 years male patient comes with generalized body pain and low back pain. He was advised complete evaluation. His report showed the following abnormal findings. So we'll note down. HB was 7 gram per deciliter, so there is anemia. Creatinine was 3.1, so there is renal failure. ESR was 130 mm in 1 hour, so a very high elevated ESR. Calcium was 13. So again hypercalcemia. The normal calcium level is 9 to 13 milligrams per deciliter. So 9 to 11 milligrams per deciliter. 13 is definitely hypercalcemia. There are multiple lytic bone lesions in the spine X-ray. So there are some bone lesions. I think the clue becomes very clear here. This is crab, right? Hypercalcemia, renal failure, anemia, and bone lytic lesions. So whenever crab clue is given, the answer definitely becomes multiple myeloma or myeloma. Some people get confused about the term monoclonal gammopathy, etc. So I'll just tell you. I told you in another video about T cells and B cells. B cells mediate humoral immunity. So how does B cells go about? When B cells are stimulated by interleukins like interleukin 4 or 5 particularly, they get converted to the plasma cells and they secrete the immunoglobulins, gamed IgM or G or A or E or D, based on a particular interleukin, based on the particular type of plasma cell which gets formed. Now we know that immunoglobulin has heavy chain and they have light chain. 2 heavy chain and 2 light chain. The light chain can come in 2 varieties: kappa light chain or lambda light chain, right? So these are the 3 proteins which are secreted by the plasma cells. They are secreted as an immunoglobulin, but to be separate, they produce separately as heavy chain, kappa light chain and gamma light chain. So they come in different combinations. Okay, in few kappa light chains will be produced and few lambda light chains will be produced. So everything comes together. Remember, when everything is mixed together, we call it as polyclonal. Okay. For example, assume some conditions where B cells are more, plasma cells are more, and immunoglobulins are more. Remember, I told you about rheumatoid arthritis. It is a disease mediated by humoral immunity. Psoriasis is a disease mediated by cell-mediated immunity. So in rheumatoid arthritis, what happens? There are more B cells. So they produce more of plasma cells and more of immunoglobulins are produced. So that excess production of immunoglobulin is actually a polyclonal production because different heavy chains, different light chains are produced. Both kappa and lambda light chains are produced. So even though there is increased immunoglobulin, it is actually a polyclonal excess of immunoglobulin. So polyclonal rise. Whenever the term monoclonal, like only one particular cell type of cell is produced, it is always cancer. It is always malignancy. So assume a disease where different types of chains are not produced. The B cell becomes neoplastic. It produces a particular neoplastic plasma cell. That neoplastic plasma cell secretes only one type of cell. Either it produces heavy chain alone in excess, or it produces only kappa chain in excess, or it produces only lambda chain in excess. Then it becomes problematic. When heavy chain is produced more, we call it as heavy chain disease. It's not important for your NEET PG, but there's a disease called heavy chain disease. When either kappa chain or lambda chain is produced more, so that is named as monoclonal gammopathy. This also can be given the term plasmacytopathy because plasma cell is becoming abnormal. So whenever the term comes plasmacytopathy or monoclonal gammopathy, it always means a disease related to multiple myeloma. So now this monoclonal, so we'll discuss this. So clearly it's a case of multiple myeloma. What is the ideal next step in evaluation? Serum vitamin D levels. Okay, maybe an ideal evaluation because we told you when calcium is high, what are the two most important causes? Hyperparathyroidism and malignancy. So to evaluate for that, we can send PTH levels, and I told you the third cause, vitamin D toxicity also is there, so we can send vitamin D, and we can send PTH related peptide, or we can check for the screening, the lytic, right? The lytic cancers. We have to look for lung cancer, we have to look for urethral tract cancers, we have to look for intestinal cancers, colonic cancers. So look for every cancer. Okay. So this also is seems to be a good option. But what is the best? They have asked the ideal next step. Because serum vitamin D level does not explain the low hemoglobin, the high creatinine. Okay. And ESR more than 100 always occurs in only few conditions, like it occurs in rheumatic fever, rheumatoid arthritis, multiple myeloma, and tuberculosis. So see, these are the conditions where usually you can tell lymphoma also. These are the conditions where ESR is very much elevated, more than 100. So ESR more than 130 does not explain hypervitaminosis D. Serum ionized calcium. So why the term serum ionized calcium? Ionized calcium has to be sent for a confirmation of hypocalcemia, not hypercalcemia. Remember, whenever calcium is low, it does not mean actually calcium is low in the blood, because some of the calcium is bound to albumin and some of the calcium is the free ionized calcium in the blood. What is the calcium measured in the serum is actually calcium bound to albumin plus the ionized calcium. But what is more important physiologically is only the ionized calcium. So the calcium which we measure is actually a surrogate of the physiologically important ionized calcium, which means calcium can be falsely low, that is measured calcium can be falsely low when albumin is low. So assume conditions like hypoalbuminemia, like in chronic liver disease, we can get falsely low calcium. In that case, we have to send ionized calcium to confirm whether the actual physiologically active form of calcium is normal or low, right? So ionized calcium has to be sent as a confirmation in hypocalcemia. There is a formula for corrected calcium, we are not discussing it here. Next is serum protein electrophoresis. So this is the investigation of choice in multiple myeloma. So that is the next step, serum protein electrophoresis. Serum CEA is a neoplastic marker, or it's a marker of colonic cancer. Of course, colonic cancer with meds also could be the answer, but it does not explain the renal failure, high ESR, etc. And nothing is given about the clinical scenario, like there's no bloody diarrhea given or no bowel disturbances given, so this is less likely. So maybe a challenging question. From this question, serum protein electrophoresis is more likely. So many of us will get confused about the serum electrophoresis. Remember this one, okay? The upright palm is out. So if you draw a graph about protein, initial spike is albumin, okay? Then we have two spikes, alpha 1 globulin, alpha 2 globulin, and beta globulin. The last gamma globulin will be little smaller than the albumin. That is how the normal one should be. Suppose if this last one is very high, spiking even more than albumin, it is significant. It means albumin is low or globulin is high. Remember, immunoglobulin is also a type of globulin. Immunoglobulin has kappa chain, lambda chain, and heavy chain. So in monoclonal gammopathy, when kappa chain or lambda chain increases, globulin has to increase. So when it is a monoclonal rise, it will rise very much like a peak. So this peak is called as M protein or M peak. M is for monoclonal peak, right? So this is actually how does it look. So this is the chromatography or serum protein electrophoresis. See, in all these pictures you can see the initial spike is very, very big. So this is the actual albumin. So the next one will be alpha 1, alpha 2, and the last one will be the gamma protein. See this image number 3. Albumin peak is more, but we are having another peak at the level of gamma, right? Which means the last one at the thumb level. So this is how does the electrophoresis of myeloma look. So the same image can be given like in a horizontal orientation, but whatever it is, don't forget this palm image. The first peak is A, albumin. Next comes globulins, alpha 1, alpha 2, beta globulins. The last one is gamma globulin. When it is very high, it is called as M peak. Of course, we are having many other investigations in myeloma. For example, previously they did the Benz-Jones proteins. It is outdated now, so don't answer this one. So which is the best screening test is serum protein electrophoresis. Serum protein electrophoresis will only tell that there is a monoclonal gammopathy. But to plan treatment, we should also find out which light chain is elevated. So there is something called SFLC, serum free light chain assay. Like it tells whether kappa chain or lambda chain is elevated. Then people also do biopsy. Okay, so these are the investigations. So remember myeloma because it produces crab. And if you have to go to the next step, like this plasma cytopathies are of multiple types. So few terms are MGUS, monoclonal gammopathy of uncertain significance. We have something called as smoldering myeloma. And last is multiple myeloma. So what is this monoclonal gammopathy of uncertain significance? The M protein level is less than 3 gram %, and the plasma cell count is less than 10%. So monoclonal, even though it is elevated, it is less than the cutoff because M proteins more than 3 gram % and plasma cells more than 10% only is the criteria to say it is multiple myeloma or smoldering myeloma. Here it is below the cutoff. So even though there is monoclonal gammopathy, it doesn't fit the cutoff. So it's called MGUS, monoclonal gammopathy of uncertain significance. Smoldering myeloma is like a precancerous condition. That is, there is elevated M protein, there is elevated plasma cell count, but there are no symptoms. So if the same question or if the same electrophoresis pattern is given, but the scenario doesn't give any symptom, then the answer has to be smoldering myeloma. Multiple myeloma, the same criteria. M protein has to be more than 3 gram %, plasma cells has to be more than 10%, plus there has to be CRAB, one of the CRAB. CRAB is hypercalcemia, renal failure, anemia, and bone changes. Okay. So we took some time here to discuss about multiple myeloma, its pathogenesis, its types, okay, and serum electrophoresis interpretation.